Welcome everyone to our Mom Baby Unit. I'm so glad you're here. We are going to jump right into our mission statement. At Dignity Health, our mission is to make the healing presence of God known by improving the health of the people we serve, especially those who are vulnerable, while advancing social justice for all. We live this mission through our 5 values of compassion, integrity, inclusion, excellence, and collaboration. For us on Mom Baby, this is especially important because we care for patients at some of the most special moments in their life. We want every interaction to be with human kindness for every patient so that every person feels safe, respected, and cared for. The American Nurses Association tells us that when organizational values are woven into daily care practices, patients feel more satisfied and achieve better health outcomes overall. So this is not just for the warm and fuzzies. This is essential and important for every patient. Our goal this year is to improve our HCAHPS scores by 10% in nurse communication specifically. HCAHPS are patient experience surveys that are sent home after discharge. We gather that data and it tells us about the care we provide for our patients. This HCAHPS data is also tied to hospital reimbursement. So it's not only attached to our mission and values, but it can also affect our budget as well. We can earn higher reimbursement for care we already provided. So it's really essential on multiple fronts. To reach this goal, we've identified 2 evidence-based strategies. First is Teach Back. This is an evidence-based tool to ensure good communication. So this is a critical communication tool where we ask patients to repeat information in their own words to ensure understanding. This is great during medication administration, just general teaching, and especially at discharge when we want to make sure that the patient is going to know how to take care of themselves at home. The Agency for Healthcare Research and Quality shows that Teach Back improves medication safety, increases patient confidence, and directly impacts HCAHPS communication scores by making patients feel educated and respected, which is really tying back into our mission of dignity. The second initiative is leader rounding. So this is another evidence-based practice. We will do this mainly with our charge nurses, but we want to train some of you nurses to step up and be leaders. And we will give you specialized training on communication, on de-escalation strategies, and on specific teach back strategies to make sure to find patient concerns before they become a problem, to proactively speak to patients, seek them out, solicit their feedback so that we can find any problems before it leads to a readmission or before it leads to any safety concerns. To implement these strategies, the resources we will need include cross-training. So we want to cross-train some of you wonderful nurses to be our leaders alongside with our charge nurses to be out there rounding and bringing that wonderful patient feedback back to staff, collaborating to make the patient experience as wonderful as possible before they go home, before we get these scores back and find out that maybe we disappointed the patient. So we are going to receive funding from our Dignity Health Foundation to invest in this extra training and to support you guys through this transition, and to make sure that all staff have proper training in teach back techniques to make sure that patients understand what we are sharing with them. This is based on some key assumptions. We assume that patients will value this communication and education. We also assume that you guys will take this mission on and integrate teach back into your care and also step up and be leaders. So we really rely on you guys to take this as a part of your daily practice. Finally, how does this fit into us? Why Mom Baby? So our Mom Baby unit is the pilot because we receive the highest survey returns in the hospital, giving us strong data to measure. And also our scores have a larger effect on the overall composite of the hospital because of our high number of returns. So by prioritizing patient communication, we strengthen the trust in our entire hospital, fulfill our mission of human kindness, and support Dignity Health's vision to be the healthcare provider of choice in our community and to do what's best for our patients every time. Thank you.